Effective January 1st, I have two children who are college graduates. One is 22, one is 25. One has a pre-existing condition. Effective January 1st, both of my sons will be able to be covered under our family health insurance policy. This will save us about $3,000 in premiums alone, in addition to providing coverage for the son with pre-existing condition. At a time when college graduates are having enough trouble finding jobs at all, much less a job that pays health insurance company, can you tell me why you would repeal that measure in the Health Reform Act?
Go ahead, Mr. Raese.
Is Governor Manchin going to answer that one, or am I? Well, first of all, I don't believe in insurance companies being mandated to handle pre-existing conditions. Now, you say that your children already, or your graduates already have health care insurance.
No. I am paying, my one son is paying, we're paying about $1,500 for him, effective January 1st, under Obamacare, under the Health Care Reform Act. They will no longer have to pay that extra premium. We will save about $3,000 because they will now be covered under that act. Every college graduate, and I have the document, whether married or unmarried, whether living at home, whether a college graduate or not, will now have the option to be covered under their parents' plan. And this is a good thing. This is a good thing for our young adults because the economy is bad, they are struggling. And I don't understand how you can say that aspect of the Health Reform Act is a bad thing.
So do you feel that this is free health care or health care made for you or made for your children? But who pays for that?
It is covered under our insurance premiums, under our family coverage, as it was before they were aged out of the system.
And then that mandate, which is a mandate, correct? Because it's mandated by Obamacare.
No, we have the option to put them back under our policy. No one is forcing us to do it, but we need idiots not to do it.
Right. But what is the problem?
What is the problem?
Right. You have health care, right?
My children do not have health care effective January 1st under Obamacare. They will have health care.
But what I'm saying is that there is no free ride. Somebody has to pay for that, right? That's called the insurance company. That's a company that employs hundreds and hundreds of people, right?
Yes. And they are a low...
Do they have families too?
Well, sure they do.
Yeah, sure they do. Now, when you have pre-existing health care arrangements, like it's sort of like if I was driving down the road and I wrecked my 54 Roadmaster, okay, and it was all smashed up, then I would go visit somebody in the insurance business and go, could you give me collision insurance because I just wrecked my 54 Roadmaster. Now, he sits there and he has to go, well, I have to take it under Obamacare. That's called a mandate. And that's something that will break all of these companies and a big part of of America today. Because when you force mandates on people and you force government intervention into the private sector, I'm not saying to you this. I am saying it is hard out there for everybody right now. It is hard out there for everybody. But when you have government that's going to intervene and put the American taxpayer and put America at risk, which we are at risk right now. We're running billions and trillions of dollars in debt.
That's too low.
Thank you.
Thank you. Mr. Johnson, do you have a comment on the subject?
I will. Thank you. I can certainly say that is one of the portions of the 2010 Affordable Health Care Act that is workable, that is conscionable, that